Hey, good afternoon. I had said earlier that I was thinking that the quiz could be the beginning of lab. And that way, if there was any last minute question you had to ask or thing you had to look over, you would have, a few moments to do that. So, all right. So we had mentioned the frontal and parietal bones of the skull. But I would like to just kind of revisit those, begin there and then move forward. So part of our goal is to be able to look at the skulls that we have here. So that would be the human skull, the bovine skull, the cat skull, the salamander skull, and name stuff. All right. If that's all anatomy was, I mean, that's valuable enough, but just the naming is dry. All right. And so what I try to do is just give a little context because, we are what our body parts have made us. And just kind of, in that context, they're important. I would be different if my frontal and parietal bones were different. And just to try to show some of that. So as we look at the frontal bone, it's one of the four bones of the skull that have holes in it, sinuses. Once again, this will make your skull a little bit lighter. It'll provide resonance chambers for speech, the same way that, the box of a guitar, that would provide a resonance chamber there. So here are different views of the frontal bone there. Now we only have one single one, but as we will see, hopefully in just a second, I'll report okay. Last class or the end, it was okay. Let's just check. So here's the parietal bone where we have a pair of those. Now this isn't, I just X'd out. Oh. So there's lots more details that we could give. And one of them would be all of the sutures where these bones are meeting. And I'm sorry, if this keeps up, we'll go to another room. I apologize for this. And so all of these places where the skull bones meet, they have names. We can talk about joints later. And to us, I think a lot of us, a joint implies movement. But that's not its anatomical use. It's just kind of where things meet. There are places of my body where I love movement, like I love the movement of the shoulder. It's a highly movable joint. It's the most highly movable joint. Also the most frequently dislocated joint. And that's not a coincidence. The more movable a joint is, the more ways you can hurt yourself. And so if there are joints that we don't have to move, then we don't, because that then gives them strength and stability, where otherwise there would be the chance of injury. So if you look at these joints here, where the frontal bone meets the parietal bone, or the parietal bone meets the temporal bone, there's no movement permitted there. All right. And these bones, they like interlock almost. We call them sutures. And we like not having movable joints in our skull because that just gives extra strength and support there. So in lab, as we continue, hopefully you get a chance to look at the different frontal bones. And let me just kind of go here. Notice that in the mink, there is no post-orbital bar where the frontal bone helps to surround the eye. Cats don't have that either. They do have a sinus. Reptiles don't, so that would be a mammalian feature. But notice this thing here. So I'd like to talk about the frontal bone and this idea that it can touch the one in the cheek. In minks, not at all. In the cat, it comes close. And in a lot of mammals, there's no trace of this. So there's no trace of a post-orbital bar. Now, this is meaningful to me because, we take classes at Orange County Community College. We have a mastodon, obviously, with us. And there's kind of like a very silly application here, which nevertheless, people didn't get for centuries. If we were to look at the earlier the earlier synapsid reptiles. See this purple bone? You don't have that anymore. See this tan bone? You don't have that anymore. So the old skulls had far more bones than they do now. All right, so we could name them prefrontal, postfrontal, things like that. But as we go from reptile to mammal, they get lost. Notice that it was this postfrontal bone and the postorbital, which are contacting the cheekbone to make that postorbital bar. So the first mammals lose it. Now, you'd hate to lose it, all right, because it's protection from the eye. But who knows? I mean, just as genes tell embryos how to develop, maybe as mammals expanded the brain case to make for a bigger brain, that was one of the sacrifices, that they reorganized how genes were expressed. And the upside was the brain got bigger, the skull got bigger. The downside was they lost these little bones that formed. So, yeah, so that happened. Who cares? Well, probably not the first mammals, because for, I don't know, 120 million years, mammals were mostly just like rodent things that came out at night. They weren't very big. Their eyes weren't very important. So protection for the eye, maybe that was a sacrifice they were willing to make. All right, so you know, you sacrifice the eye that, nocturnal animals aren't using much anyway. And so here in this armadillo, being a, typical primitive mammal, there's no bar there. All right, there was just a space, one space for both the eye and the jaw muscles. And the same thing here. Now, if you don't know any better, you go up to this mastodon, which we see here in the BT building here, and you say, here's one space, one space. What you're missing is that the eye goes here, that mammals lost the postorbital bar, which would go here, and the jaw muscles go here. So one loses the idea that this is really two spaces, a jaw muscle space and a eye space, because you only see the one space that's not divided. So if you're an early person, and by early person, this goes up into like the 1700s, what do you make out of this? Like someone shows you that, what do you think it is? What kind of animal? Okay, good, a mammal. And more specific, you want to throw, or no, no, you would say this is a giant cyclops. Why? Because if you don't get that, that's the eye hole. All right, you think, oh, that's the jaw hole. So you look over here, and elephants, as I'm sure you know, have a trunk. So the nostrils go here. And so what you see is a big skull with one hole in the middle. You say, oh, this was a giant human which had one central eye. This was the Cyclops in the day. And this not only in Europe, way back when, but even like in the 1700s in the colonies, the Puritan thinker Cotton Mather, if anyone really got into, there was a series out called Salem for a while, and one of the characters was Cotton Mather's son. So anyway, Cotton Mather is never relevant to your conversation, but like I had a window that maybe, so I can't not throw it in there. Anyway, they thought these were giant people, and would even then like tell moral homilies about this, because in their telling of it, this is what happens when women hook up with angels. So for all of you out there, no hooking up with angels, or else your kids look like this. See, there was like all these things. And then it was only realized later, wait a minute, no, this is the eye hole because this is an elephant, all right? And that was the nostrils for a trunk. And, there was no moralizing that needed to happen. Notice the cat apparently wants that postorbital bar back, all right? So it's close. The frontal bone almost touches the cheekbone. In the ancestors of primates, same thing. You see that little nub? This is not a primate, but it's on the way. They want to get that extra support back. And when we get to the primates, one of the definitions of primate is a postorbital bar, protecting the eye. The lemurs do it, the monkeys do it. And in fact, once we get into the out of the lemur category, I have it somewhere. Sorry, we have you get to 6,000 videos, and then the one that you want to show, you're like, what folder did I put that in again? It's here somewhere. Oh, let's go here. So to get to a primate, that was one of the things, you get a postorbital bar. Now, a couple of the other groups thought of that as well. So horses started off without a post-orbital bar, but they get one along the way. Camels start off without a post-orbital bar, get one along the way. So primates weren't the only ones who said, hey, let's protect the eye more. But if we talk about our lineage, then that's it. Notice, however, in the lemur that the frontal bone supports the eye there, but not there. All right. But as we get into the later one, so here's a tarsier. Notice there's a little more bone here. There's a hole still, but a little more bone than the lemur had. And then by the time you get to the South American monkeys, look at that. It's full of bone. So the eye gets more and more protected by bone over time. Primates thought of it, but then what's called the anthropoid primates, they decided, let's do this even more. All right. And so here you can see here's a little here's a little marmoset, etc. And as I said, we have one frontal bone as an adult, but the ancestral condition was to have more than one. And here you can see that in a human fetus, there are two which are fusing. And you can help tell some age in childhood by the degree of fusion that would result here. So frontal and parietal bones. And now we are ready to move on. Right. Oh, okay. And I'm sorry, just no, maybe not quite yet. Once again, the frontal and parietal bones were not that much bigger in the first hominins than they were in chimpanzees and gorillas. So their brain is chimp-sized. Some of these Australopithecines, you see that on the top of the skull? That is between the two parietal bones. And we're going to see this a lot next week when we talk about arms. But if I'm a muscle, all right, I'm going to grab this chair. That doesn't work. So grabbing smooth surfaces, not good. If you want to grab something, you grab an edge, like you were going to pick up something, grab the edge or whatever. And so when we look at bones, very often you look at like the humerus. Look, there's a bump, there's a bump, there's a groove. Look, there's a hole, here's a bump. What's going on? Muscles go there. That's where muscles are pulling. And so when you look here, what's going on there? The answer is these things were chewing something that was really fibrous. You can tell. I mean, A, the teeth are huge. B, the cheek is huge. C, the lower jaw. Look at that. Oh, that's huge. But then look at where the jaw muscles were going. All right. So it wasn't enough to have jaw muscles start here and go here or here. They had to go up here and be even bigger. All right. So while normal apes were in the trees eating leaves and monkey and hard and easy to chew things, some of the hominins, they were coming out on the ground and feeding on more fibrous things, which took more chewing. And then the frontal bone, as I had mentioned, we say you are hominins, but we'll give you another name. But we will call you Homo. And the reason is because of the frontal and parietal bones allowing for a bigger brain. So our genus Homo is defined by, hey, we've decided to make more brain space here. And then the last thing I had said is, these members of the genus Homo, they had big brains, but the skulls were shaped differently. Who has a forehead in this picture? Only Homo sapiens really has a forehead. Right, everyone else, their skulls are low and long. Homo sapiens has one that's higher, and obviously, this individual member of my genus had a brain that probably had about as much volume as mine, but shaped differently. And look at those brows. So when we talk about what makes Homo sapiens different from the other types of Homo, which have been around for 2 million years, the frontal bone is a big part of it, like the shape of it giving a forehead, the lack of the brows, etc. So it's not just a bone to name, but also, I think a little bit interesting in that context. But now we go on into, okay, so I apologize. Here is that prefrontal bone, all right? Here's a post-orbital bone. There were a couple others a little earlier on. So notice we mammals, we don't have them, all right? But the reptiles still do. And so part of being a mammal, once again, if we were to take this reptile skull and make it into a mammal skull, what happens? Well, notice there's 3 bones around the orbit which get lost. So you didn't really have to add anything, but instead you took stuff away. So Temporal. Let's do occipital. Where's occipital? There we go. We humans have one occipital bone, right? So we are starting with, in the bones of the skull, what we call the cranium. And out of all of the bones of the skull, some of them enclose the brain. So there is a space here, and the soft, squishy brain goes there. And so the bones which are protecting it in a box of bone, they are called the cranium. The other bones, which we will then do afterwards, are called the face. All right, so we have done the frontal bone, the parietal bone. Now I'm going to talk about the occipital bone behind, but this is a third bone of the cranium. We humans have an occipital bone. So here's the occipital bone, here's the occipital bone all by itself. Here's the occipital bone with the rest of the skull. Now, it wasn't always like that. If you go back to fish, there isn't an occipital bone. There's an occipital region with lots of little bones, all right? There's a hole there, which I'll talk about in a second. All right, but lots of little bones. And if you look here at the alligator, clearly, there's a bony region in here, bony region there, bony region there, multiple bones. Okay, we could name them. I just want you to know the trend. You don't have to know the names, but there's things like tabulars, postparietals, basio-occipitals, exo-occipitals, etc. So a bunch. Same thing here when you look at this these anapsid and synapsid reptiles, there's a bunch of little bones there. But what happens over time as we go from here to there to there to there, they start to fuse together or get lost. So by the time you get to right around the first mammals, and people argue, is this a mammal or is it an almost mammal? When I started teaching, everyone said it's a mammal. Now the preferred term is a mammaliiform. You don't really care, but it's, on the way to being a mammal, either like a very primitive mammal or right before that. There are still separate pieces, but most of them are gone. Now, that's fascinating to me, at least. Because if you were to look at how the human occipital bone forms, here's a fetus. And look, there's a bony region up there, fusing with a bony region here. And then there are three bony regions there, 1, 2, and 3. You'll see the third one from another angle in a second. All right, so you have bony region, then you have exooccipitals and basio-occipitals there. So not only did the fetal occipital bone come together from the fusion of smaller elements, just like it did in mammals over millions of years. It's not only pieces, it's the same pieces. Reptiles had 2 exooccipitals, a basio-occipital. We as a fetus had 2 exooccipitals and a basio-occipital. And so the occipital bone is our first composite skull bone, a bone which forms from the fusion of smaller elements. Okay. Now, if you ask a whole bunch of mammals, fuse your occipital region. It turns out not everyone fuses it in exactly the same way. So while it's fusing, you might find, hey, this piece, which in humans ends up on the occipital, in other animals could end up attached to a different bone. So like pieces are fusing, but how they fuse might vary. And I'm going to say something, I know this is weird, but there is the assumption that on the inside we're all the same. All right, I always make it where I know on the outside we vary. Our hair is different, our ears look different, et cetera. But on the inside, we're the same. And so when we talk about bones and blood vessels, there's the human anatomy, and then we just have variations on the outside. Turns out it is not that way. We vary as much on the inside as we do on the outside, if not more. All right. And so here's an example where the parietal bones meet the occipital bone. Look at that and look at that. That's an extra little bone. Do you have it? I don't know. Some people do and some people don't. Here, see that big chunk there? Some people have that, some people don't. Those pieces, some people have them, some people don't. So we could call them different names: sutural bones, wormian bones, Incan bones. The point is, as all of these little things are smushing together and fusing, all right, not everything happens the exact same way 100% of the time. You could actually have a few more bones than the person next to you. You could have an extra vertebra. I mean, there's variations everywhere in the skeleton, but you could have little separate bones of your skull in between the occipital and the parietal bones that your neighbor does not have. So I think that's interesting. Now, about the occipital bone, two things leap out. One, that's a big hole. Can we all agree that's a big hole? Big hole? All right. It is called the foramen magnum. Do you know what that means? Big hole. So very creative these anatomists are. All right. So there is a large hole, and this is where the spinal cord enters the skull. So on one side of the hole, you have spinal cord. On the other side, you have brain. All right. So this is where the spinal cord enters and becomes the brain. I do want to talk about these with not only here, but also in the vertebrae section. And there's a joke, but you're not going to laugh twice. So I'm going to put the joke off until the second time we hit this today, just so you know. So these bumps are where the occipital bone touches the vertebral column. So if you think about it, like my skull's big enough. I mean, it's got a whole lot of area, but where here does it attach to my chest? It doesn't. See, like if I want to prop up my head, there's nothing here. So who's holding my head up? Those two bumps. That's where the skull meets the first vertebra in the vertebral column. That is where we support our skull, nowhere else. So these bumps, which we will call condyles, the condyles of the occipital bone, that is where we support the skull. And like I said, there was a little bit more to say, but it's a little funnier once we get to the vertebrae. So if you don't mind, we'll wait. All right, so that's the occipital bone. The last thing I would like to say, and this is, once again, if I beat this to death, I apologize. No, actually, I don't apologize. Just warning, I'm going to. So if you were to look at a monkey's hole, the foramen magnum, that's it. Okay, and if you were to look here on this rhesus monkey, once again, or chimp, all right. However, the significant thing is, if you were to look at that hole, it kind of comes in at an angle. All right. All right. So that's a slight angle there. If that were my head, if my head looked like this, I would be standing before you right now like this, because my spine would come in at an angle, forcing me forward, changing my center of gravity, forcing me to use my hands for support. So the apes that do that, well, they can walk on their hind legs, but they usually don't. They're usually running on fours with their hands being used for locomotion. All right, and therefore, like the knuckles have to, be, changed to bear body's weight, et cetera. And I'm a little biased on this. I kind of really pressure the role the hands play in playing guitar and piano and other musical instruments. Chimps can't do that because they're running on their hands. If you were trying to run on your hands, it would then affect your ability to play sports. Like you would have different hands. All right. Now you look at those Australopithecines. Let's take a close up. Look at that hole. It's not coming in here. This is where a chimpanzee would have the hole. It's coming in here. That's an inch. The hole moved an inch. And if you were to ask someone outside comparative vertebrate anatomy and say the hole moves an inch, they would say, who cares? But we don't, that's an important inch. That makes the difference between being quadrupedal and using your hands for support and being bipedal and upright walker. So once again, I think as we go through these bones, it's not just here's a bone, name it, here's a bump or a hole on the bone. No, it's like this hole moving an inch was crucial in our ancestry. It made the difference for being bipedal. All right. So, I think a lot of, these have very interesting stories to tell. Here's another Australopithecine. Once again, notice the hole right there. Okay. Wonderful. Okay. Now, I apologize. I just want to, like, how, if we were like serving you lots of food, which we're not, like we might do like a little sorbet as like a palate cleanser. Okay. The bone that we're about to talk about is the hardest bone of the skull. All right. So just if you say, oh, it's so hard, if only there was a song about this hardest bone of the skull.
About idiots, make some moan, hear these tales of the temporal bone. Oral is, please don't be dumb. Take care of the bones of your cranium.
We'll do one
I
verse.
know a girl, her name is Jess. She cut off from mastoid process. I asked her, did this make a mess? But she can't nod to tell me yes.
All right, so there's that. So if this weekend at the CVA party, you're like, oh, if only there was a temporal bone song, there is. Now the temporal bone. This is the hardest um, of the bones by far in the skull. So let's start this. Now, because we are more interested in the bone, we're not going to name all of the holes and all of the things that necessarily need. I just want to point out everything that it does. But once again, if we were just dealing with one species over 2 semesters, like anatomy and physiology students do, we would get to know all of this, but we're not. We're doing all vertebrates in 1 semester, so we're not going to do the same amount of detail. But the temporal bone is the bone in yellow. Okay, so it's part of the cranium, helping to enclose the brain and protect it here. But there's so much more. All right. This is where the jaw joint is. So our jaw joint is called the TMJ, the temporomandibular joint. So here you see the lower jaw, the mandible. It's only one bone, the mandible. And here you see the temporal bone. So there's a spot where the lower jaw articulates here. So when you chew, it's your temporal bone articulating with the mandible, which allows that. Then we have a bump. I told you a second ago that bumps mean muscles go there. Right. You can actually feel this one. It's just in front of your ear. And the muscles which you use to say yes go there. Right. We'll talk about muscles later. But that's a reason to really focus on bone stuff at first, because then when you get to the muscles, you're like, oh, the muscle goes there. Right. So one of the things that we could really emphasize, we only emphasize it a little bit, but is origins insertions. So the sternocleidomastoid muscle starts on the sternum and clavicle and goes to the mastoid process of the temporal bone. Why it's called the sternocleidomastoid. So when it contracts, it pulls on the mastoid process, and this is how we say yes. Okay. So a lot of these bones will have bumps on them, and that's why we care. Now, we make such a big deal about this with reptiles, and I mentioned this once already. The first reptiles did not have a hole in the temporal region. So that's a hole in the temporal region. The first reptiles, as we mentioned last week, didn't have it. And we named them the anapsids, no holes. Okay. Then the lizards, the snakes, and everybody else, they are the diapsids. They have 2 holes. So let's just get. So the first amphibians, no hole in the temporal region. Okay. We then get to the first reptiles, no hole in the temporal region, no hole there. So notice there, no hole there. This is what's called an anapsid, no hole there. Early turtles, no hole. All right, and I'm kind of saying this in this, sarcastic, angry voice, because the geneticists who say that the turtles started off as being diapsids, the fact that there were no holes, is and the people vary depending on whether they're looking at anatomical or genetic evidence. But anyway, let's get out of that argument. Here's a crocodile, or I'm sorry, an alligator. 2 holes. 2 holes. It's a diapsid. So lizards, snakes, birds, crocodiles, dinosaurs would be diapsids having 2 holes, okay, in the temporal region. Our lineage has 1. So we often don't think about this hole of the skull, but it's huge. Look how big that hole is. So this is bounded by the zygomatic arch. If you touch the cheekbone, that's the zygomatic bone, and you drag your finger to your ear, your finger is going along this zygomatic arch, and it encloses a hole. The first reptiles didn't have it. We do. Who cares? Well, if you didn't have a hole there, your jaw muscles would be this big because they would stop. There would be no hole for them to go through, which would mean when you bit into something, you really wouldn't have a powerful bite or a powerful chew. But because of this, your muscles can go through the hole and can go up to here, can go up to here. And you saw that hominid that has the ridge on its head, the way the gorillas currently do, it could even go higher, right? Now, that's awesome, but bragging rights actually go to the horned dinosaurs. If you remember the dinosaurs with the big frills, like we say, oh, that would be great to protect your neck from Tyrannosaurus Rex. True, but also a major reason for having that frill, maybe the major reason for it, is because your jaw muscles can go up to here. Imagine how powerful your bite would be in your chewing action if you had jaw muscles which went up to here. Right, the horned dinosaurs were probably feeding on plants that nobody else could eat. These cycads, because they were so tough and fibrous, no one else could chew that. It looks like palm trees on steroids. How thick the leaves are. They're so thick, these cycads. But horned dinosaurs could apparently do it. All right, and so these holes then give you reason for the jaw muscles to expand, and we name the ancestors of the mammals by the hole. We call that the synapsid opening. And then the mammals which would, I'm sorry, the reptiles which would lead into the mammals are the synapsids, right? And so as you become a reptile going into mammals, you have one hole for jaw muscles and one for the eye until, as I said, the first mammals lose that and the two holes come together. So we mammals, we have that synapsid opening uh, uh, that the temporal bone encloses. So, like I said, when we talk about, what group we what belong to, we call ourselves synapsids, and so, the temporal bone has that's the vertebral. Okay. So that's one of the features of the temporal bone. Okay, so there's that synapsid open, and so here you can see mammals and their coming up. Come on, where are we? Oh, there. Sorry. So here in pink, you'll see all of the mammals. We have this synapsid opening, so we call ourselves the synapsids. And there are two jaw muscles which can go through that hole, and thus you have a more powerful bite. Okay. There are some more things here, but once again, we just don't have time to go through everything. There's a little process that your tongue helps to hang from called the styloid process there. And if you were to flip the temporal bone around, and you look at the inferior view. So if that's the, this is the foramen magnum here, the big one with the two occipital condyles. There are two holes. Okay, there you go. There are two holes in the temporal bone for the blood vessels of the brain. So oxygenated blood reaches through the carotid canal, venous blood comes out the jugular foramen there. So the temporal bone is complicated. It's got a mastoid process for the muscle, a sternocleidomastoid, a styloid process for the tongue. The socket for the lower jaw is there. It helps to make that arch for the jaw muscles, has holes for the blood supply of the brain. And the craziest part, I'm just going to say this, and it won't make sense, but I'll just kind of plant the seed and we'll get back there. Your temporal bone has a hole in the middle of it. All right, I'll explain why that is in just a second. That's a hole in the middle of the temporal bone. Why? Because that's where your ear is. You have a middle and inner ear. Your middle and inner ears are actually inside the temporal bone. How on earth could that happen? Well, I imagine that you can kind of, here's the occipital. What you're going to see here is you see that yellow temporal bone? Like, it's complicated, but that's nothing compared to what it once was. Because the fish, the amphibians, the reptiles, the earlier mammals, they didn't have a temporal bone. They had lots of little elements, some coming from the splanchno-cranium. So let's label them here. Okay. Some coming from the chondrocranium. Let's label them there. Some from the dermatocranium. Okay, here come these. All of them then smushed together to make the one single temporal bone and the little bones inside that hole that I'll get to. So when we look at more primitive vertebrates, we don't see a temporal bone, we see the pieces which would then become ours. So the quadrate is one of the ear bones inside the temporal bone. All right, but here you see in a bowfin, it's actually part of the jaw joint. Mammals have a different jaw joint than everybody else. So here's the quadrate. If you're saying how on earth could this be tested, I'll just be honest. Uh, I do like to stress this, and I do like you to know it. But because it's complicated, like I could ask you, like I will ask a written thing, just kind of sum up what you're saying. But like I could ask you to identify this, but I then to kind of compensate, I also then will then have bonus questions where like, if this section of identifying skull bones, is there's 15 of them, let's say. Then there'll be a couple questions at the end which are extra, so you could get a couple wrong. So I'm going to show you like the salamander in a second. That's an easy one to ask. And so if I'd like you to get it, so you study. But if you missed it, it doesn't necessarily count against you. That's kind of my philosophy. So there are pieces of the temporal bone, which in other animals are separate bones. All right. So there's a squamosal bone. There is a petrosal bone. Now that means nothing to you, and really that's okay. It means nothing to most people. But when I said there's a hole in the middle of the temporal bone, and if you ask how on earth could there be a hole, well, you could have two bones, and the two biggest were the petrosal and the squamosal, fusing together, and then just keeping a space between them, and that's where your ear is. All right, so you'll actually see these in the cat skull as two separate bones still. Um, there. So here in the frog, all right, they don't have a temporal bone, they have separate parts of that. When I said the salamander, if I were to say like, where is the easiest place for me to like point to something, and the squamosal would be the easiest, but like different parts of the temporal bone, that would be here. So the squamosal and the petrosal, they become the temporal bone, and the quadrate is inside as one of the ear bones inside. So in mammals, this just looks a little different. The pieces are here, but in mammals, they'll have to fuse together. Right, so there's the squamosal in the turtle, the quadrate. The quadrate is part of the jaw joint. That what I'm saying doesn't make any sense to you, but I'll mention it again in a few minutes, and then hopefully you say, "Oh yeah, he mentioned it." Okay. So in the alligator we have this, but you get now to the cat, all right, and we just kind of have a temporal bone. All right. So by the time we get to the mammals, they fuse together. That being said, if you look on a cat, and maybe it's a younger cat even, if you look here, if you look really close, because like you'll have these in your boxes, you'll have cat skulls cut we can find. If you can see, can you see there's a line here? That means it's still kind of fusing. See this line? So this should be one bone, but it still kind of looks like two. And so, like I said, in different lineages of mammals, things can fuse together different ways, or some things can fuse with age. I'd have to check how, you check the age of a cat based on temporal bone fusion. But here you can see this is the inside part, the petrosal. The outside part is the squamosal. All right. So once again, you have a temporal bone, but literally came from little pieces. And if you look at the cat, there's one piece, there's the other. You can still see that this can be gradual. Um, and so if you were to look at these the temporal bones, once again, there's some holes for the blood vessels that go to the brain, the carotid and the jugular. There's the arch, there's the socket for the lower jaw. So, the temporal bone is an important, it certainly is an important bone. And the jaw stuff we'll get to later. If you were to look at a human fetus, once again, you see the different pieces. That's a separate bone. That's a separate bone. There's a separate bone. The petrosal is here. There's even a mastoid portion, a styloid process. So once again, this would be an example of a composite bone that forms from the fusion of many separate bones. Okay. So the temporal bone is perhaps the hardest bone of the skull. Yeah, so then here was just, the temporal bone has those holes in it for jaw muscles. And as I had said before, the first reptiles don't have any. And then we have both the synapsid condition and the diapsid condition there. Okay. Two more bones of the cranium, which surround the brain. One is called the sphenoid. This looks crazy, all right? And once again, just because of our pace through this course, I'm really not going to focus on this. I'll tell you where you can identify it in the skull, but we're not going to focus on all of the little parts. It actually is interesting. It touches every other bone of the cranium. So it's the only bone that does that. So it helps hold the skull together. And if you're thinking, oh, I've never heard of the sphenoid bone, well, because it's holding the rest of the skull together, you'd kind of have to break the skull apart in order to get a good look at it. All right, so it looks like this, which just looks insane. And if you say, where is that? Well, you can see a little of it here. All right, so a little of it is going on there. You can see a little of it here if you cut the skull open. So because it's tying everyone together, you kind of have to rip the skull apart in order to see it. If I wanted to ask it of you, here is the easiest place. If you look at this, which is called the internal base of the skull, right smack in the middle is a depression. That is the sphenoid bone, as is this part here. How on earth could a bone look like this? Well, hopefully you're already guessing the answer. Hopefully you're guessing, I'll bet you a lot of little pieces fused together to make this weird thing. And that would be right. So like you didn't have one bony center like forming this. You had like these little things are called pterygoid processes. They were their own separate bones, et cetera. So there's all of these different parts of the sphenoid, all right, that then fuse. So in humans, we have one separate bone, but and here, if we rip the face off, it would be the orange bone, right? So that's what we would see there. But as before, if you were to say, how do you make a sphenoid bone? Well, you've got pieces of the chondrocranium and the dermatocranium all fusing together. And if you were to ask, well, an amphibian or reptile, what do they have? Well, they don't have a sphenoid bone. They still have these separate pieces. So you would say there'd be all these terms you'd have to learn, like the allophenoid, the pterygoids, and you won't. But just saying, if you wanted to study the skull of a reptile, there would be some more pieces there. Here they all fuse together to make sphenoid, our sphenoid bone. Now, it's a wonderful thing to know because we'll talk about the brain soon enough. That little depression is right under the hypothalamus and the pituitary gland. All right, so just, that's a really neat, just landmark. Oh, I know where I am in the brain. The hypothalamus and pituitary right over this. That's where the optic nerves come out through this optic foramen and crisscross. So you're like, oh, okay, I know where that is. All right, so, the eye socket, there's some nerves going through these cracks. And once again, a little bit beyond us, but depending on where your, futures in anatomy go, we can't memorize everything in one class. And my A&P students, they memorize some of these holes. They don't memorize all of these holes. But if you were like in more an advanced human anatomy class, there's holes in the sphenoid where you say, oh, this cranial nerve comes through this one, this cranial nerve comes through that one. And you'd have to know all those things. So, this complex bone has importance, as does the last bone of the cranium called the ethmoid bone. So if I were to rip the face off in gray, I can see the sphenoid, and in front of it, I can see the ethmoid bone. It has a sinus, all right? So if you look here, notice here's the sphenoid area. Oh, there's a hole. Sphenoid area, there's a hole. Here's the ethmoid region, a hole. Here's the frontal bone, here's a hole. So there are three bones of the cranium which have holes or sinuses, the frontal bone, the ethmoid, and the sphenoid, and then even one bone of the face, the maxilla or maxillary bone. So 4 bones of the cranium have sinuses: frontal, sphenoid, ethmoid, and the maxilla bone of the face. All right. So how could you see this ethmoid bone? How could one ask this ethmoid bone? Well, if I were to take this skull, where all the bones are different colors, rip off the face, it would be right under there. So it's under the nose. So you could rip the face off and see it. That's one way. If you, somewhere, sorry, give me a second. There is a famous preparation of skull bones called the Duchenne skull. So I'm sorry, I thought I had a picture of it. So if you were to look at this Duchenne skull, like the skull bones are kind of like exploded and separated from each other. And then here you can see the ethmoid. So once again, if your instructor wanted you to ask you an ethmoid bone, he could point to this preparation of the skull and you could see it there. All right. Or the easiest way is this is the frontal bone, this is the frontal bone, but this little part in between them, that's ethmoid. So the ethmoid bone can be seen in the internal base of the skull. Right. So here's the sphenoid, and the ethmoid would be that area right in there. Now, there's lots of stuff going on here. One is there's little holes, and that's where your olfactory nerves go. So you can smell because from your brain and your olfactory bulbs, olfactory nerves go to the olfactory epithelium where you smell from. Okay, so there's that. There's a bump here that helps to anchor the brain. So when you go to a concert and you start doing this, all right, your brain isn't like sloshing around and slamming in the skull because it's wrapped in meninges and the meninges attach there. So it's helping to anchor the brain there. All right, we'll talk about in the respiratory system, when you breathe in dust and dirt and debris and germs, you cause it to swirl around. It gets stuck in mucus, and that way you can take it into your stomach to die instead of in your lungs to cause an infection. Well, the ethmoid has 2 of the 3 plates which help to swirl it around. And the ethmoid also has what makes up part of the nasal septum. So if you look up a skull's nose, right, you'll see that there's a plate that separates the nasal cavity into 2, left and right halves. There's a bone of the face called the vomer that makes up the bottom half, but the ethmoid makes up the upper half. So the ethmoid makes up one of the 2 parts of the nasal septum. So once again, I think these things are all awesome, and their stories are incredible. But then there's also just the temptation. We can't spend too much time on any of them. So that was it for the cranium. So just to review, we have the 2 which are hardest to find are the sphenoid and the ethmoid, because you really only see them well when you rip the face off. You can see the ethmoid here. Those plates that have all the little holes for the olfactory nerves are there. You can also see all those little holes from this view, but also notice that the ethmoid is making up part of the plate which sticks and breaks the lateral, the nasal cavity into lateral halves. Part of the sphenoid and ethmoid come from the condocranium. So before there were like bones and like a sphenoid dermal bone, those condocranium parts were there, the cartilage. So cartilage pieces, which would someday make the parts of the condocranium and the composite bones in humans here. So here we look at a salamander. There is cartilage here that will contribute to the ethmoid. There are ones here which can contribute to the occipital bone or to the temporal bone. All right. So if we were to talk about the history of the skull, the bones which are made of like multiple pieces, therefore that have multiple histories. Like so this piece has this history, that piece has that history, etc. So here's a pterygoid bone. Wait, I've never heard of that. Right, the pterygoids are processes on the sphenoid bone. So here it is as a separate bone before it fuses. Interestingly, the fish and the amphibians and the early reptiles, a lot of them had teeth on the roof of their mouth. So some of the bones that you just heard, they could have teeth there, right? And in fact, I know it's a little odd, But if you were to ask your dentist, have you ever, seen teeth in the roof of the mouth? They'll tell you yes. Yeah, there was a kid in here, 2 months ago, and I had to extract teeth from the roof of their mouth. It happens, right? So that was an old vertebrate feature that some of these bones could have teeth in the roof of their mouth. So here is a salamander's skull, the inferior view. It doesn't have a sphenoid bone, but it does have the parasphenoid and the pterygoid. Now, these are separate bones, which are part of the vertebrate bone. So here, once again, the pterygoid, that's part of the mammal sphenoid. The squamosal, that's the big part of the mammal temporal bone. So once again, a lot of our bones come from smaller pieces which smush together. And so once again, parasphenoid and these making part of the temporal. Here on the alligator, all right, still a couple of, the squamosal that makes up part of the temporal bone. The quadrate is inside the temporal bone. But look at pterygoid, ectopterygoid. Once again, there are just multiple bones that would end up fusing here. So now, by the time you get to mammals, you get to like a pterygoid process of the sphenoid bone. But notice the basal sphenoid in a cat is still a separate bone compared to the rest of them. So, this fusing together, this happens very gradually. So here you would see the sphenoid area here. I don't want to steal the thunder from a future lecture. All right, so I'm just going to say this very quickly, and if I say it quickly and don't emphasize it, my bet is you'll forget by the time we get to the respiratory system. So I'll get to use this cool little analogy twice, and you won't notice. That's my goal. Okay. If I were to ask you to just, oh, did you have a question or? Oh, I thought you were like, I'll remember. Okay. Okay, I was like, darn, blew it. So if I were to just say, please take a second and list what you think are, I don't know, 5, 10 most important parts of your body that separate you from non-human animals. Go. And next time we do it, I'll give you more time. So stop. All right, see, I didn't give much time at all. And if I asked, how many of you are thinking of the position of the hyoid bone that we'll talk about in a little bit, or how many of you are thinking of the length of the sphenoid part of the skull? You didn't. All right. But I'd like you to look at the sphenoid. It's long. That's a long sphenoid. All right. And when you look at such a long sphenoid, that means that a lot of mammals have a longer face. A lot of primates have a longer face. It turns out, though, that messes up your vocal tract in that you cannot make the repertoire of sounds that human speech requires. So chimpanzees and gorillas, they're pretty smart and they can do sign language. They can't do spoken language, but it's not an intelligence thing because they can do sign language. They just can't make the right sounds. Why? Because this area is just too big. Our ancestors squished the face. And I'll bet you a bunch of you had to go to the orthodontist and had to deal with, I have too many teeth in too small a space and I have to extract some and rearrange some. I know I certainly did. But if you look at my mouth, there, I'm missing 8 teeth. I don't have my wisdom teeth, and there's 4 premolars which are extracted. So if you take 8 teeth out of my mouth, make me wear braces for 3 years, and then a night brace for a year and a half more, everything lines up. But if you don't do that, I'm a mess. So why did vertebrates screw up their faces and need orthodontists? Because by shortening this, now you've changed this space, which can now make the diversity of sounds which we humans use in speech. And if you were to think about what makes us different from the non-humans, speech is one of the really big ones. All right, if it wasn't for speech, human history would be a bit different. So once again, just a lot of people would just pass by the sphenoid as this annoying thing, but the change of its shape, we might not have speech without it, and then that's certainly critical. Okay. Anyway, that is the cranium. So part of the skull encloses the brain and protects it in a box of bone. Before we take our first break, I'd like to run through the face, which takes us much less time. All right. So if you were to take the cranium and take the skull and make the cranium go away. Okay, so cranium, go away. So there it goes. What you're left with is the face. These bones do not protect the brain. So what are they? Well, the zygomatic. That's what you call your cheekbone. And the reason you call it your cheekbone is because it's so darn easy to feel. All right, there's not a whole lot of skin or fat that you have right here. So just underneath your skin, you can feel that cheekbone really easily. Note that that's the other one that helps to make up the post-orbital bar. It's the yellow bone touching the frontal bone, the zygomatic bone touching the frontal bone that makes the post-orbital bar. And the zygomatic arch that I talked about with the temporal bone is where the temporal bone touches the zygomatic bone. So here your jaw muscles go here because the temporal bone has a zygomatic process contacting the zygomatic bone. All right, so this cheekbone, all right, is helping to, give us that room for our jaw muscles, helps to protect the eye from the lateral side, all right, the zygomatic bone. So that's kind of cool. Next, we have two nasal bones. So our nose is mostly cartilage. Most of this is cartilage. There's a little bit of dense connective tissue at the base here. But then there's what we call the bridge of our nose. Here, the bridge of our nose is made of bones called nasal bones, these two small ones. Okay. If I were to look at the skull from this lateral view, notice there's the nasal bones, but here's a little tiny bone called the lacrimal bone. So it, like many things, has an interesting history. Here it is in humans. It's really small, right? See? All right, it touches a bunch of bones, as you can see. All right, but it's this little tiny bone. It was once bigger, like it goes way back. So this is a fish, a bowfin. Underneath its eye, it has a lacrimal bone. So like this is old, maybe older than the frontal bone. And it used to be bigger. So if you were to look here, see the dark blue lacrimal bone, it goes all the way to the tip of the snout. All right, so it starts in the eye where it does in humans, and it is longer. But then as time were to go on, can everyone see like the bluish gray bone is smaller now? Okay. And then by the time we're getting into the primates, it's just confined to the eye. So here's an opossum. It's almost confined to the orbit, but it's a little bit outside the orbit. By the time we get to the primates, it's just in the orbit. So the lacrimal bone is old, but it's gotten a little smaller as time goes on. Okay. And it has a hole in it. Why? Well, because your eyes have a tear on their superior lateral side, which makes tears, a gland that makes tears. And this then goes over the eye to clean it and lubricate it. And then it goes into a little hole that drains into a sac into the nasal cavity. All right. So tears, like if you speak Spanish, lagrima, tears, all right? So lacrima, I'm imagining Latin, is this bone that has the tear duct. So the tears that you make drain laterally over the eye, I'm sorry, drain medially over the eye into this lacrimal foramen and lacrimal duct here. So humans have a small lacrimal bone, right, which has a little hole, the lacrimal foramen, to drain tears. Okay. So that is a bone. The maxillary bones, or maxillae, here they're kind of like the dark purple. And apart from the lower jaw, they are the largest bones of the face. Right. So apart from the lower jaw, they do like, so obviously, there's teeth involved that touch. But apart from the lower jaw, the maxilla will touch all of the other bones of the face except for the lower jaw. So they're big, all right? They hold the teeth. All the teeth in the upper jaw are in the maxillary bone, although I'll have to explain that in a second. So here's the maxilla bone. Here are the teeth. Okay. And yeah, there's just, and I had mentioned a second ago, so I'll mention it again now, that there are 4 bones of the skull which have sinuses. 3 of them are in the, oh, come on, where'd you go? 3 of them are in the cranium. I'm sorry, this isn't where the picture is. All right, so 3 of them are in the cranium. This is the frontal sinus, the sphenoidal sinus, there are ethmoidal sinuses here. But if you look there, there's a hole too. All right, that's the sinus in the maxilla. So the maxillary bones are the only bones of the face which have a sinus. So 4 bones that have sinuses, maxilla is the only bone in the face. It has the teeth, but I'm being truthful, but not super truthful when I tell you that. And the reason that I'm being kind of truthful is that your ancestors had their incisors in a premaxillary bone. So you don't have one anymore. But if you were to look at this bowfin, look, there's the maxilla. Ooh, in front of it is another bone, the premaxilla, which has oh, I'm sorry, you'll see that in the next one. So the frog has the maxilla there, the turtle has the maxilla, the alligator has a maxilla. But notice how the red's not going to the tip of the snout. That's because the cat has maxilla. That's because the incisor area was its own separate bone, the premaxilla, which we see there in the bowfin, here in the frog, here in the salamander, here in the turtle. All right, so in addition, here in the alligator, here in the cat. So in addition to a maxilla or a maxillary bone, we have a premaxilla. Now, if we were to say, just find that. Right. So there we go, separate bone, the premaxilla. Here we go, nice, look at that. It's its own separate bone. In the salamander, its own separate bone. The frog, we have it, its own separate bone, etc. Somewhere. So there's the premaxillary, even going into now mammals. When you were a fetus, you had a premaxillary bone, but it then fused to the maxilla. So you do not have a premaxillary bone anymore, which I would show you, and I will show you in a second. But you did have it as a fetus because when you look, say, at a cat, it is still a separate bone that holds the incisors. So today, all of your bones are, all of your teeth are in the maxilla. But as a fetus, you once had the more primitive vertebrate condition of having a premaxillary bone, which, tell you what, after break, I'll just show you the picture of a fetus and you can still see. Okay, so the premaxilla, that's a bone of the face. You have a mouth and you have a nose. Just looking up to see who's shocked by what I just said. No one. But that is kind of special because turtles don't, all right? Frogs don't. All right, now they on the outside, look, they do have nostrils and a mouth. But look at where the nostrils come out of a frog. They come out here. So what does that mean? What space is that? Is it the mouth or the nose? The answer is it's both. The mouth empties into the space, and here are the internal nostrils. They empty into the space. So inside, frogs don't have a mouth and a nose. They just have one space. Same thing, the internal nostrils of the turtle, they come in here. They just have this one space. All right. But for mammals, that won't work for reasons which we'll talk about with the respiratory system. So mammals, we just need more air. All right. I mean, just maybe I'm bad mouthing them a little bit. But what are turtles doing right now? They're under frozen water, breathing through their skin. And even, yes, they're even breathing through their butts in something what's called cloacal respiration. All right. Now, how much oxygen do you get breathing through your skin and breathing through your butt? Not a lot. But it turns out you don't need a whole lot of oxygen to run a turtle. All right. So that's okay if you just have one hole. Because with one hole, all right, you have a choice to make. Like if you tell a turtle, hey, would you like to eat food or breathe? If all you have is one hole, you can only do one thing with one hole. All right. Mammals, however, you just need to breathe all the time. And you need to eat a lot because we have high metabolic demands, being 100 degrees and having big brains and walking upright. So we have what's called a palate, all right? A separation between the nose and the mouth. The turtle and the frog didn't have that. They had one space. But we don't. Here's the oral cavity with the palate above it. The nasal cavity would be over that. So we separate our breathing nasal cavity and our eating food by this hard palate. And the hard palate then is made by two bones, the maxillary. All right, so I'm just go to the cat because that's the one you have. So we have maxillary bones here and the palatine. So another bone of the face is called the palatine. And together, the maxillary bones and the palatine make up the hard palate, which then allows us to eat and breathe. Like, think about these cows. When do they stop chewing? They don't. And if they had to stop breathing when they wanted to chew, then they wouldn't be able to breathe and we wouldn't have any cows. So the hard palate is important in us mammals getting the oxygen that we need. And it is formed by the maxillary bones there and the palatine. As we go through bones of the face, I mentioned that when we inhale, we want the air to swirl around so the germs get stuck in mucus. The ethmoid does that a little bit, all right, and so does this bone of the face called the inferior nasal concha or turbinate. So conchae or turbinates, there are three of them. Plates that stick out in the nasal cavity so that when we inhale air, if it's got smoke or dust or germs, the swirling around gets the stuff that gets stuck in the mucus. The ethmoid bone has two of the three pairs, and then one of the ones is its own separate bone there on the inferior nasal concha. Okay. So that is a bone of the face. Another bone of the face I mentioned is the vomer, which splits the nasal cavity in half. So if you look at a skull's nose, right, it gets split in half. The top part of this nasal septum is the ethmoid bone. The bottom is the vomer. So if you look here, the ethmoid would make up this part, the vomer would make up that part, and together that would split the nasal cavity into two. Okay. So there's one left, but before I go into that. So the face is the part of the skull which has all of the bones which aren't protecting the brain. There are the nasal bones making the bridge of the nose. The lacrimal bones, which have the duct for the tear duct. In our ancestors, they were longer. The zygomatic bone, which is special in us in that it helps to make the post-orbital bar that helps define the primates. It touches the temporal bone and makes the zygomatic arch here. The maxilla touches all of the other bones of the face except for the lower jaw. It has a sinus. It helps to make up the hard palate along with the palatine bone behind it. That way the nasal cavity is separated from the food in the oral cavity. There's that lacrimal bone again. Your ancestors had a premaxilla, which we do not have anymore. And that leaves the lower jaw. Just want to see if there's any pictures you didn't see. So in our minutes before the break, I'm sorry, I forgot the hyoid bone. We'll talk about this bone and then just mention the hyoid as well, the lower jaw. Now, when I say we are going to talk about the exciting aspect of the lower jaw, right, nobody believes me. All right, and you're like, oh, all right, this is not interesting. And I get where you're coming from. In humans, it's one bone, just one. It's kind of boring. Okay, it's got this place that articulates with the temporal bone to form the TMJ. It has teeth in it. It has some hole for nerves. So if you want to apply oral anesthesia to the mouth, you need to know where the holes are, where the nerves are. There's room for muscle attachment. And you're thinking, we could go on now, right? So that's the lower jaw. We're done. If you were to look at an alligator's lower jaw, so there's the jaw, jawbone and has teeth. Wait, that's a different bone. Wait, that's a different bone. That's a different bone. How come there are multiple bones? And it turns out the story of the lower jaw is actually far more interesting than what a lot of people would think. So let's start off with, say, bony fish. Let's draw the lower jaw. Each of these bones, the colors has a name. You don't have to know them. But just the ones you want to focus on are the blue one. That's going to be the one that ends up as being our only lower jaw. Also, just, I hate to be a spoiler, I would watch yellow, red, and then even the pink a little bit as well to see if they do anything interesting. Okay, but here we are. Here's a fish. And when fish open and close their mouths, it is because there is a jaw joint between the red bones and the yellow bones. Quadrate articular jaw joint. That is the old jaw joint. And I say old because you have a different one, and it's an interesting story. So that's the lower jaw, a lateral view and medial view. I name all the bones if you care. You don't have to care. Now, we go from fish into amphibians. All right, there's some changes. The blue bone's getting a little bit bigger. We get into some reptiles. All right, getting bigger. But still, the jaw joint is between the red bone and the yellow bones. All right, that's still the jaw joint. We get into the synapsid reptiles. And like right around here. Let's go there. And now there's some interesting things going on. So first off, the blue bone is taking over. All right, that will soon be the only bone in the lower jaw. Here, the blue bone is starting to touch the temporal bone. So we have two jaw joints going on here. There's the yellow and red jaw joint. That's the old one that will be on its way out. But the blue bone touching the temporal bone directly, that's on its way in. So if you were to ask the question, and it's an interesting question, how does one evolve a new jaw joint? The answer is you go through a transitional phase where you have two, the one that's on its way out and the one that's on its way in. One gets gradually smaller, one gets gradually bigger. And we start to see that in the synapsid reptiles. There. Also, there's a lot of those like little bones end up like forming like this rod on the inside of the lower jaw. Now, you may not care, but interestingly, when you were a fetus, you had a rod on the inside of your lower jaw that was the leftover ones of those. And also, this pink bone's kind of making a hook, and we'll see that in an unlikely place. We get more advanced mammal-like reptiles, interesting here. We get now more advanced mammal-like reptiles, interesting here. So notice we've just got only a few of those ancestral bones broken into that bar on the medial side. There are two jaw joints. When this mammal-like reptile opens and closes its jaw, the yellow bones contacting the red are part of the articulation, but now the blue bone touching the temporal is now the major one. And this pink bone has a hook. By the time we get to the first mammals, all right, we are now looking like this, maybe. So look at this. That's a maybe. Or like this. And I say, because where do you draw the line between what's a mammal-like reptile and what's a mammal? Turns out different people do it different ways. And it used to be that everyone did it here. And so that, all right, sorry. Yeah, I'm sorry. It used to be the people did it here, and these were mammals. But now, maybe they're doing it here. So like just, it's actually, if you were to ask which reptiles in the Triassic, are they mammals or just mammalia forms, you end up talking about these bones a lot. Like in the groove, are they still in the groove or are they now here? But let's just talk about what they do in us. In us, your lower jaw is just the blue bone. That's it. So you have a mandible made just of the dentary bone, and as such is the largest bone of the face. You once had two, but then they smushed together along the midline when you were young. But what happens to the yellow, the red, and the pink bones? Interestingly, you still have those. They used to be part of the jaw, and the yellow and the red ones, they used to be the jaw joint. And if you ask, where are they now? We get back to the temporal bone and the hole it has in the middle. Because in that hole, we have ear bones. We have a stapes, an incus, and a malleus. These are leftovers from those bones which used to be in the region. So the yellow and the red ones, the old reptilian jaw joint, that's them. All right. The early vertebrates used them to open and close the jaws. They were big, but they got small and small and small. Now they're just inside the temporal bone and they help it with hearing. And when you were a fetus, this is the dentary, but this is those other ones, the yellow, the red, and the pink. They form in the jaw region. And remember I said the pink bone has a hook, like a little circular hook? There's the pink bone being its own separate bone still. And in you, it supports the eardrum. So when mammals changed their jaw joint, they ended up now no longer having a use for the yellow, the red, and the pink bones. So they used them in a different way. They used two of them as bones of the middle ear, which means that mammals hear better than reptiles. All right. I mean, birds are a different story, but that's another story. So for example, a rattlesnake probably can't hear its own rattle. All right. Reptiles aren't all that good at the auditory thing. And we mammals, it's the incorporation of these middle ear bones into the ear that helps to make our hearing what it is. Okay. One more bone of the skull. So the skull is made of the cranium, the face, and then if you wanted to add, we could those middle ear bones. All right, that would be made a separate category. If you wanted a fancier name, maybe auditory ossicles. And then the final one is this bone over the larynx called the hyoid bone. Now, no, the hyoid bone is just weird. It's just a little bone. You wouldn't think it has an interesting story, but the little bone has these different pieces that came from the cranium, different pieces of cartilage from different gill arches. So each of our embryonic gill arches then had pieces, and the pieces smushed together. All right. And they do so in different ways. So if you were to look at the hyoid apparatus of a turtle, can you notice there's a little more to it? All right, just like a few more of those pieces. All right. So if you were to look at the hyoid apparatus of birds or here the hyoid apparatus of a frog. So here's the hyoid apparatus of a cat. I mean, can you see there's a piece, there's a piece, there's a piece, there's a piece, there's a piece. There's just a lot of pieces from those splanchno-cranium cartilages which fuse to make this, as we had mentioned last class. So we have it, and it helps to support the tone. Now, I asked you a question a few minutes ago, like to name the biggest, most, parts that set you apart from animals. I talked about the sphenoid part, but this was the second half of that, the hyoid bone. In human infants, the larynx and the hyoid bone are located higher up and then go down. So if you were to ask a normal mammal, where's your larynx and hyoid? A little higher than it is in us. We start off with high and then it descends. Well, there's a downside to that. The downside is we choke on our food more. If you're going to lower your larynx and hyoid, you're going to choke on your food more. So that's a downside. But the upside is it's important to speech. So once again, what makes us different from the non-human? Speech it's one of the big ones, all right? And it's little changes in the position of the hyoid and how the sphenoidal section of the pharynx, which help to enable that. So I'd like to throw that up because then these bones that you might otherwise not, give much attention to become more significant. So on this skeleton here, when you come up here, and the hyoid bone is right at the tip of my finger. It's surrounds the larynx, and I'll get a little separate hyoid bone. So that is the vertebrate skull. When we come back, let's have a meeting of the minds on the vertebral column, and take it from there. So let's take a 15-minute break. I said I would show you these two things. So that is a fetal skull, and those are the premaxillary bone. So you can see that even though all of our teeth as adults are held in the maxillary bones, including the incisors. We, like more primitive vertebrates, including the primates, we had our incisors in separate premaxillary bones. Second thing is I'm going to put this over there. This is the hyoid bone of other animals, a frog, a turtle, a bird, and a cat. And you can see the hyoid bone can be just crazy complicated with all of these different sections. So you can look at that. All right. I'm sorry, let me just, yeah, I'll keep recording for that. But, all right, so then where are we? So in lecture, last class, we talked about cartilage and bone, how bone forms, etc. These interactives should probably just take a couple minutes to go through. And then these question sets, not only do you get a grade, it'll keep your highest score, but if you're wondering, what might a multiple choice question on an exam look like, they would be drawn from here. So today we went through like parts of the skull, including the face, and that would be where to stop for this week. Next week, we're going to start on the vertebral column and then go through the arm and the leg, and that will then go through the skeleton. So this was lecture, and then the corresponding stuff in lab. Once again, I know this looks like a lot of assignments, but each interactive, probably take you, say, 3 minutes or so. So, even if you wanted to do them here in lab, maybe work on them together, and get points for it, you could be done most of these. But this will point out the things you should know on the bowfin skull, the frog skull, the salamander skull. And as I had mentioned, and as you just saw on today's quiz, there'll be some bonus questions too. So just in case you're like, I'm struggling with the salamander, skull. But, so if there's one question on the salamander skull, that you could get that wrong and still do just fine. So the remainder of the day, you can just, use these for practice, and then go through. You have the skeletal material there. I'm happy to answer any questions. And then otherwise, once again, we will finish the skeletal system next week. Please let me know if you have any questions. Stop this.